Eat, sleep, read, repeat. Hey guys, today I'm going to talk to you a little bit about what to expect in your first year of your clinical psychology or your PsyD program. And if you like learning about mental health and other topics in psychology, as always, subscribe and hit the notification button. So the main things that I'm going to talk to you about today, guys, are the main differences between a doctorate level and a master's degree or bachelor's level program. Also talk to you guys about the schedule the first year, what classes you're going to take the first year, and what assignments you'll typically be doing, so you have an idea for that and the amount of time that they'll be taking you. The major difference between a doctorate program and master's or bachelor's level is just what the professors expect of you. They told us ahead of time that we need to have a business professional attitude. So that comes down to even the way we dress when we go into class. They expect us to dress business professional. And this is also because there's actually a clinic in the building where we take classes. So if we're running into clients, we always want to be looking our best. Even little things like getting to class on time, the professors really stress, because that just shows that they're not there to baby you anymore. You're just going to be expected to show up on time. Professors also expect that you already know how to read research articles, write a research literature review, do a presentation, and cite all your sources. They're not going to be spending time on going over how to do this stuff. They're expected that you learn that in your bachelor program. All this can be a little nerve-wracking when you're starting out because you're with these larger-than-life professors. They've all done amazing things in their career. But after the first couple weeks, you're definitely going to feel more comfortable with them and you'll get used to it. So in terms of the schedule, it might be a little inconsistent. I had a lot of days where I had tons of classes and then some days where I had no classes. For example, in the fall, I had 3 classes on Tuesday at 9:30, 1:30, and 4:30, and they were all 3 hours long. But then Monday and Wednesday, I didn't have class. So that was nice because I could catch up on readings and assignments on the days I didn't have class. Thursday, Friday, I had 1 class. So overall, I don't think that you could work full-time and do the program full-time. You could get away by working part-time just a little bit. I know some students that have a job on campus 1 day a week just for a couple hours, and they're fine with that. When it comes to summer, you're finally going to get a break and you're only going to have to take 2 classes, which is kind of nice. So now I'll go over the classes that you guys might actually take your first year. The first one is adult psychopathology, where you're reading the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. And you're learning every disorder and its criteria, and you're gonna memorize that to write down on your finals. It can be a little tedious at times, but I actually do find the different disorders pretty interesting. Some professors are gonna want you to write it down word for word, but most will be okay with you having the general criteria in mind if you can explain it by writing it down on paper. Next, I took assessment and intelligence testing, where we actually learned how to give the WISC and the WACE intelligence assessments. So that's pretty cool because you can administer that to a child or adult, and you could actually diagnose them with a learning disability or ADHD based on other data that you're gathering. But those assessments are really important. They're used in a lot of different fields of work. Next, we had a diversity class where we're basically learning how different ethnic groups, racial groups view therapy, and how when we're working with them in session, we want to take that into account. Then we had child development and older development. We also had ethics and legal issues in psychology. And then we also had systems of psychotherapy, which we went back in time and learned all the different types of therapy that have come about, from Freud psychoanalysis through Carl Rogers humanistic to Beck using CBT. So we'll be able to use different tools from all those therapies and apply them to the situation whenever we need. In the winter, I took history and systems of psychology, which was more based on ancient philosophy and how that's impacted current day psychology, some of the major movements and shifts. We took child and adolescent psychopathology, so applying the DSM criteria to children and adolescents. We took diagnostic interviewing, where we actually role played with each other. One of us would pretend to be a client coming in to the session for the first time, and the other would be the therapist, just asking them a bunch of questions to gather information in an intake interview. Then we had adult intervention, where we started learning CBT, and we actually did more role playing in that class. Each class, our student partner would pretend to have a different type of mental disorder, and we would treat them with a different type of CBT. Then we had a pre-practicum on Fridays, which was in a group on Zoom, another chance to practice our clinical intake skills. We had actors that would actually pretend to have different mental disorders. In the summer, I'm taking a substance abuse elective and cognitive affective aspects of behavior. Finally, we had to take statistics. In terms of assignments and what to expect, I would say on average, each class you're gonna have to read about 3 articles or 3 chapters per week. So that could maybe be 100 or more pages. You're definitely not gonna get to all of it, and you're gonna become really efficient on scanning, highlighting, and writing down the most important notes that you need to know. Then each class is going to involve some type of presentation, usually a 20-minute PowerPoint presentation, or you'll have a partner and present on a topic. Next, each class usually involves a midterm or a final exam that usually has a multiple choice, short answer, essay, and then a case study. In the case study, you may have to pick out the symptoms of the client and come up with your own diagnosis based on the DSM. Some classes you might have to write a 10-page paper, but I haven't had to write that many long papers yet in my first year. So that's a quick summary of what to expect, guys. I hope that was helpful, so when you come into your first year, you're not completely caught off guard. Yes, it's definitely gonna be a lot of work, but you're gonna realize that when you're forced to do it, you're gonna be able to do it, and you're gonna be much more capable than you thought. If you have any questions or comments about what happens in the first year, leave them below and I'll get back to you guys.